People are dying around me every day. Worried Jamaican healthcare worker battling COVID 19 in New York City. When two young Jamaican women migrated to the United States of America, never in their wildest dreams did they envision that one day they would be working on the front lines trying to save lives during a global pandemic like the new coronavirus. Jamaican Shavon Josephs, 30, a patient care associate, and Nordia Bailey, 25, an emergency medical technician, are two persons who make up the thousands of health workers who are burdened by the number of people made critically ill by the coronavirus outbreak in New York City. As of 4 o'clock yesterday afternoon, at least 131,569 people were confirmed cases of the coronavirus had been discovered in the states, including more than 72,000 in New York City. At least 4,758 people who have been infected with the COVID 19 have died in the state, which has the largest number, or around 44.5% of confirmed cases in the U.S. Joseph, who is from Ocho in St. Anne, works at the Long Island Jewish Medical Center and told the newspaper that nursing is her passion and she loves to help people. But since the outbreak of the COVID 19, things have been different. It took a turn in February when the coronavirus came out and reached the US. I'm scared to work. I don't want to be at work because most of my coworkers are infected with the virus. Work is not the same anymore, Joseph said. She gets sad caring for patients who have the virus. For Bailey, a first responder for senior cares located in the Bronx, traveling back and forth in the ambulance reminds her that one day she may not go home. Each time the dispatcher sends us a call and it comes in as COVID 19, it hits differently. Your heart skips a beat, you start to fret. It's like a whole different feeling comes over your body. In your mind, your thinking is that going to be us one day? Are we going to be in that same position? She told the newspaper. There are more dead patients than live ones. Bailey, who is from Portland, said she is tasked with performing life saving techniques en route to the hospital before transferring care to higher level persons. She told the newspaper that she's seen far more dead patients than live ones at the moment. We're going in, dead bodies are coming out. It is a scary sight, really a scary sight. And what I'm seeing now, we're running out of space to the point where dead patients and live patients are in the same room. It's crazy, she said. Joseph said she has been working long hours because colleagues are sick and cannot show up for work. No one is showing up for work. I'm getting mandated to do a 16-hour shift because of shortage of staff when I'm supposed to be doing only 8 hours, she said. Both ladies complained bitterly about the personal protective equipment and maintaining their own health and safety. I have to put my health first. We're not getting the proper gear to care for these patients. People are dying around me every day. This virus is serious, Joseph said. We do not have adequate PPEs. Right now, the only PPE we wear as first responders are goggles, gloves, and masks because we do not have gowns. If we do have gowns, we have to save them for when we're doing CPR, recitation, or intubating. Other than that, it is just our uniform. So this is where we have to be extremely careful after each call, Bailey told the newspaper. The ladies told our news team that while they love their jobs, no teaching or training prepared them for today's fight. I don't think the training that we got in school prepared us for this because there's no cure for this virus, Joseph said. Bailey, who has been in the field for over a year, said her training definitely did not groom her for COVID 19. It is more than a gunshot, it is more than a stab wound, it is more than a collision. This is completely different. It is a virus that is wiping out the entire nation. No one was prepared for this, she said. Joseph said she has not cared for any Jamaican. However, she came across a married couple who are Jamaicans and were confirmed with the virus. I interacted with one Jamaican lady whose husband was diagnosed with the coronavirus. She later went and got tested and was also positive for the virus, Joseph told the newspaper. Family time now is precious. Joseph is worried about her daughter, while Bailey is missing a son, whom she goes days without seeing since the COVID 19 outbreak. It is crazy because I leave for work early, I don't see my son, or my son doesn't see me, and when I get home, he's sleeping, and the cycle goes on for another day or two. It is affecting family time a lot, but you gotta do what you gotta do, Bailey told the newspaper. Both Bailey and Joseph are yearning to see the back of this virus and are asking everyone, even Jamaicans back home, to stay home and help others first responders in their fight against the dreaded COVID 19. I'm asking people to follow the rules and stay home. It saves lives. I just can't wait for this pandemic to be over so I can go back to my normal life, she said. It is serious. Take care and be careful.